Many preventative services are free under the ACA. Here's what that really means.
I'm Maya. A lot of people skip checkups because they think they'll get a bill. Under the ACA, many preventative services cost you nothing. Let's look closer.
Most health plans must cover a set of preventive services at no cost to you, no copay, no coinsurance, even before your deductible. When you use an in-network provider, there are 3 lists: preventative services for adults, for women, and for children. Each covers screenings, vaccines, and counseling. Adults get blood pressure and cholesterol screening, colorectal cancer screening ages 45 to 75, depression and diabetes screening, and recommended vaccines. Women get well-woman visits and contraceptives. Children get immunizations, developmental, and vision screening. A 50-year-old gets a routine colonoscopy, a preventive screening ages 45 to 75. The plan's allowed amount might be $2,000, but you pay $0. That $0 is required by the ACA Preventive Care Rule, regardless of the $2,000 allowed amount. The free rule applies only with an in-network provider. Go out of network, and the guarantee can disappear.
If that free colonoscopy finds a polyp and removes it, the visit becomes diagnostic, and you may owe coinsurance or your deductible. Free applies to the screening, not treatment.
Quick recap. Preventative care. Simply. Covered preventive services are free. No copay, even before your deductible, as long as you use an in-network provider. If a preventive screening turns into treatment, like removing a polyp, cost sharing may apply. Free covers the screening. I'm Maya. If this helped, hit subscribe and I'll see you in the next one. Let's make insurance simple.